Hong Kong will bar all foreign tourists and transit arrivals to the city starting Wednesday. It's the city's latest attempt to contain the spread of the COVID-19 outbreak after a sudden spike in imported cases. Now, for more, our correspondent Roland Lim joins us from Hong Kong. Roland, tell us more about this current ban.
Right, yep. Hong Kong to close its borders to non-residents for 14 days starting Wednesday midnight. This is because, of course, as you said, there's been a recent surge in the number of coronavirus patients. Hong Kong reported, remember, 44 cases on Sunday. That was the second highest single-day spike since the outbreak began. Now, many are believed to have brought the infection home with them from overseas. Now, the two-week ban on transit passengers at the airport will also come into force on Wednesday night, midnight, I should say. The Hong Kong residents returning home from Taiwan or Macau, they'll also have to go through quarantine for 14 days. That's a rule already in place for arrivals from the rest of the world. Now, all non-Hong Kong residents who arrive at the airport will be barred from entry, as you said, along with anyone from mainland China, Macau and Taiwan who has had a recent travel history elsewhere. There's only one exception, which is Macau residents who will still be allowed to fly into Hong Kong airport. Remember, Hong Kong is a major aviation hub and supports Macau, and then they'll be taken straight back to Macau by coach. Now, calls, of course, has been growing for an entry ban on all non-residents, with medical experts and lawmakers from both sides of the political spectrum, pro-establishment as well as pro-democracy camps, saying that the move would reduce the pressure on the city's hospitals. However, most of these, or those found to be infected after recent travel abroad, I should say, have been local people rather than non-residents themselves. And since Friday, anyone showing symptoms of COVID-19 flying into the airport will be taken to one of two nearby testing centers for checks. Those who test positive for the virus will be taken straight to hospital. Others will be allowed to go home to self-quarantine themselves for 14 days.
All right, Roland, so these are the travel bans, but is Hong Kong also considering other restrictions, though?
Right. The other ban is the sale of alcohol at more than 8,600 outlets. And this is, of course, to curb the large number of groups congregated there. Mrs. Lam said that the government would amend the law to forbid the 8,600 restaurants, bars, clubs that hold a liquor license to sell alcohol, but she didn't give an effective date when this ban will take place. Now, the government is now discussing with representatives from the catering sector, bars, these clubs and entertainment venues, whether or they should be shut or open for limited hours. This has not been confirmed yet. The government's panel of health experts, however, all agreed that restaurants and bars should be closed. Remember that in the past few days alone, we've seen quite a number of these cases that were linked to bars or restaurants in Lan Kwai Fong, which is a popular hotspot. Bars and wedding banquets, for example, should be targeted first, say the experts, because they have been responsible for clusters of cases recently. Mrs. Lam also said that she is mulling over financial assistance to the businesses that will be affected and is considering compensation to the catering sector, but no plans as yet. There also have been calls by the government to consider shortening the operating hours of public transport, and this is also to help curb spread of the virus.